welcome, and thank you for allowing me to present today, or tonight, depending on what part of the world you live in. Before I begin my presentation, I would like to pay my respects to the traditional landowners, the Wurundjeri people. They were the traditional custodians of the land for which I live and work, and I pay my respects to their elders past, present and emerging. My presentation is about a diagnosis, and I always say there is more to a diagnosis than a name. I've broken the presentation into a few different sections. I'll tell you a little bit about SWAN Australia and my journey, the journey of what is probably a typical family who has an undiagnosed child or a child with a rare condition, a little bit about pre and post diagnosis challenges, and also opportunities. So SWAN Australia. I first set up SWAN Australia when I was looking for a support group, only to find there wasn't a support group in Australia. We had SWAN UK, but there was no SWAN Australia. So late 2012, I naively went about setting up a support group. Had I known how much work it was, I'd be working for no money for quite a few years, I probably would never have done it. But maybe naivety was a good thing, otherwise it may not have got off the ground. SWAN provides information and support to families caring for children with undiagnosed and rare genetic conditions. Originally, we just set out to support families who had children with undiagnosed conditions. But as genomics has exploded, more and more of our families are getting a diagnosis. Yet, in some regards, with peer support connections, they're no better off because there might be one or two children like theirs in the world. So they stay with SWAN, and that's where they've made their friends, and that's where their tribe is. We really want to connect people and empower people to make their own friends and peer support networks within SWAN. We want to limit isolation and the emotional and social impacts of having a SWAN child. And it's been a little bit more challenging in this COVID era to do that. We want to increase awareness of the large number of children living without a diagnosis for their genetic condition. And we want to educate professionals so they can support our families better. We run a range of events from family days, conferences, a dad's group, a siblings group, morning teas, and also a number of virtual events and informal catch-ups. And we do systemic advocacy in a range of different ways, from lobbying politicians to writing submissions to sitting on committees to make sure the SWAN voice is heard. In Australia, we estimate around 50 children are born every year without a diagnosis. And just imagine if that was one of your children. How would you feel? We know 40 to 60% of SWAN children will never receive a diagnosis for their genetic condition. And we know the average time to reach a diagnosis is 5 to 9 years. And approximately 40% of SWAN children will receive at least one misdiagnosis. SWAN has formed partnerships and collaborations, both in Australia and overseas. I'm part of the Undiagnosed Disease Network International, and SWAN, together with the Australian Genetic Alliance and the Genetic Support Network Victoria, has formed the GUARD Collaborative. We represent consumer views, and we work with industry, researchers and clinicians. We have the potential to make a difference. So what does having a SWAN child look like? I often equate it to being in limbo land, similar to Emily Pearl Kingsley's poem Welcome to Holland. For SWAN families, the plane hasn't landed, and it's a land full of uncertainty anxiety, isolation, and frustration. You're vulnerable and you feel guilty. You have ambiguous grief that comes and goes when you'll least expect it to. And we all know that the rate of carers suffering depression is incredibly high, and that's not surprising. Sometimes you feel helpless and you go through that denial period. I remember thinking my daughter would just catch up, would just get the poor eyesight and the low muscle tone fixed up and she'll be fine. And you're emotionally vulnerable. And we know that the stats around relationships breaking down is also incredibly high. And SWAN families have concerns and questions. What if my child has a regressing condition? How long will she live for? Why haven't I got a diagnosis? We're living in an age of genomic sequencing. Why doesn't she have an answer? And we tend to overanalyze and question things. And what's the impact if I want to have more children? Will they also have this rare genetic condition for which no one can give us an answer? Will a treatment lead to a cure? And we know supports are often system-based, not needs-based. And what about a diagnosis? Access and equity to obtaining a diagnosis is not always fair or what we would like. To get a genomic sequencing test in Australia, it often depends on where you live, which state, and the same would apply for the rest of the world. Some people are asked to pay out of pocket for this test. In Australia, the genomic sequencing test is only funded for children under the age of 10 that meet certain criteria. And not everyone meets that criteria, but they still would like an answer for their child's genetic condition. There's long waiting times, and that depends on which hospital you go to. And then there's a level of trust. If your genomic test is sent overseas to a lab outside your country, do you trust that they're an accredited lab and are going to do the right thing and look after your data and not share it without your knowledge? Can you trust the result when it comes back to you is accurate? Not everyone has opportunities to even access a genomic test, and some have to wait at least 5 years to see a geneticist. And not everyone has the opportunity to be put into a research project if clinicians can't find an answer for your child's genetic condition. So the impact of a diagnosis can be harsh, but it can let you know what to expect. It can give you tools on how to cope. It takes time to process, and sometimes you can change your focus and treatment and therapy and go for those more targeted supports. But there are feelings of sadness, relief, grief, worry, guilt, and numbness. But there's also the value of knowing, and that's understanding about the genetic condition, the connection and support you can find when you have an answer, the research projects you can contribute, and you have a glimmer of hope about the future. Our diagnostic journey took 9 years. My daughter was misdiagnosed twice. For me, it was a relief. I never realised how much weight I carried on my shoulders till we finally got that final answer of FOXP1 syndrome. It was an emotional time, but it allowed me to understand some of my daughter's behaviours, and the way she was due to her genetic condition. I wasn't a bad parent. But the biggest thing for me was connection and support. I've been able to connect with other families with the same condition and learn from them. I've been able to contribute to research, and we know a little bit about what the future might hold for my daughter. I always think it's important to get a diagnosis. You can understand the medical implications, and that leads to more effective treatments and targeted therapy. So you're not wasting time and money on ineffective solutions to help your child. You become an expert in your child's condition, and often you're the one educating clinicians and therapists. There's opportunities for increased collaboration, education and research, and it allows you to accept the behaviours and the conditions and some of the medical implications that come with that. And again, peer support has been gold and is gold for so many families. It's allowed you to access services with less bureaucracy. You can actually tick a box. You now have a name for what your child has. And many carers report having decreased mental health rates as a direct result of obtaining a diagnosis for their child. I always say knowledge is empowerment, and empowerment leads to informed decision making. And I'd go further and talk about social precision medicine. What is it? Well, I describe social precision medicine is the information and knowledge shared between families who care for a child with the same condition. And with that knowledge, they can take their experience of caring for a child and share it with another peer who can then take that information to a clinician. So for example, instead of trying lots of drugs for a certain symptom, you might try the drug that someone in your peer support group has tried first with great results. So long term, it's going to have cost savings for the healthcare system and for you as a person. And I think as genomics expands and people connect more with one another, both in their country and overseas, we'll see more of social precision medicine occurring. Thank you for listening and enjoy the rest of the summit.